मैं आपको today I am going to explain what is occlusal rebalancing. Every human being who is using their teeth, the teeth will wear. One will wear more, one will wear less. So they go into imbalanced occlusion. At one point of time, they go into imbalanced occlusion, and then wear and tear keeps on increasing. Some people have symptoms, some people don't have symptoms. Symptoms means tooth will have pain, intraoral symptoms and extraoral symptoms. Intraoral symptoms mean teeth will wear off and will hurt, you'll get a root canal done. Some will break, you'll get a cap done. Some will, gums will swell, you'll get a cleaning done. Some bone will recede, some will become mobile and fall off. So many intraoral sign symptoms develop and many extraoral symptoms, because when teeth wear, jaw tilt, the lower jaw, the upper jaw, they don't meet in a proper position, and as they don't meet in a proper position, the TM joint, which is a load bearing joint, but it tilts, and the muscles associated with TM joints start giving symptoms. So some people may have symptoms, some people don't have symptoms. So some people are completely asymptomatic. Those who are completely asymptomatic extraorally means बात के बाहर नहीं है, migraine नहीं है, कान में आवाज नहीं आ रही, there's no muscle pain, there's no trismus, there's no tenderness. So there are multiple symptoms which are linked, which are given in this link below. उनको कुछ लोगों को कोई भी कॉम्बिनेशन में सिम्टम साइंस हो सकते हैं, और कुछ लोगों को बहुत कम होगा, कुछ लोगों को ज़्यादा होगा. जितना जल्दी डिटेक्ट होगा उतना अच्छा. सो जितना जल्दी होगा हमें उतने कम दांतों को बैलेंस करना पड़ेगा, उतने कम दांतों को रेस्टोर करना पड़ेगा. नाउ हाउ डू? वी जस्ट check the imbalance occlusion, check the level of imbalance occlusion, and then we restore them without doing a single root canal. In this, if you see, we have done the restorative balancing. In this, the original condition is this. This is the original. You see, this is bone, it's not touching here. This canine tip is not there. Some teeth are not. So now this is the condition in which the patient came, and this is what we have given. This is all restored with composite and equilibrated, means the pressure is divided, because unequal pressure causes the imbalance occlusion causes unequal pressure on teeth, and we have to restore them and balance them by equilibration also. So if you see this one, these are all composite restoration, many are composite. This is composite. Now this is the original, and this is built with composite. This is composite. This is composite. Can you see this? You can appreciate this here. You can appreciate the canine. So we have given a canine guided occlusion with protrusive and latrusive check done. Forces are distributed because all occlusal parameters are considered in this maximum. Maximum parameters are considered. This you can appreciate in this portion also again. See, this is original, and this is after we finished. Again, you see in this zone. This is original. There is no cusp here, and this is what we have given. We have built the cusp. So if you can appreciate it, this is original, and this is what we have given. Again here, this is original, and this is what we have given. So in the lower one, I will show you I will show you from here. This is original. You can see the enamel missing here, the canine tips, lateral, central incisor bone, this portion. Can you see? Original and restored. Original and restored. Again, I will so teeth, depending upon the patient we have and patient's criteria, we restore them. Now this is the way we rebuild them. This is, you can see the rebuild, how we have rebuilt them. So we have converted the imbalanced occlusion to a balanced occlusion by just adding composite, but it has to be added on. How much and where has to be added on has to be decided, and then it has to be equilibrated. So we give a balanced occlusion which is mutually protected and doesn't damage much of TM joint. So we either you do treatment at a current level, which is worn teeth imbalance level, or you decide which is the corrected level and work according to the corrected level we do. So in this old crowns were also some maybe changed and some were not. You can see in some portion this is the upper, this is original, and this is rebuilt. In the again I'll show you how we have done. In wherever there are changes means we have either reduced or increased, either added or reduced. Original is this. See, this is a worn tooth, no enamel on the top surface. So we have added on. So on this parietal side only added, because it was required only on the link this side. So we added only on some portion, and we gave a balanced occlusion. So this is a balancing. So this is known as occlusal balancing. If you do occlusal balancing, the wear and tear will be less, and the damage of teeth and the wear of teeth will be very less than extraoral symptoms which those people who are suffering with multiple symptoms like clicking joint pains, pain during chewing, yawning while opening and closing, pain in front of the ear, jaw stuck open, and TM. Some people get ear sounds, some people get ear blockage, some people are this is tinnitus, known as tinnitus. Some people are early morning headache. Mostly people have migraine. They keep going to dentist, or they keep going to doctors for treatment of migraine. They keep going to ENT for treatment of vertigo or ear blockage or pain, but it doesn't get treated because TM joint is linked to teeth, and when the teeth go into imbalance, the whole joint is tilted and muscles are pulled in and around the joint, causing multiple problems to multiple people. Some people diagnose they live with it, and some people keep on going to doctors to find the cause, but they don't get a cause. So if you fill the link which is given below, then you can diagnose the problem early and or either prevent it at that stage, or you treat at that stage but at a corrected level, not at a current level. Current occlusion is a imbalance occlusion, that you must have heard. And there's something which is different, is this is not alignment, this is balancing. So you must read what is the difference between alignment and balancing. This is balancing. We are balancing specialist.